Welcome, folks. My name is Trent Duncan. I'm here with Russ Scala and Beth Dillaha. We're going to talk about coaching and behavior change and how that's becoming a hot topic, and we can integrate that into the medical system. All right, so Russ, give us the 60,000-foot view on how coaching in the medical system is becoming integrated into one.
This is a really exciting time right now. Eric Topol's book, The Patient Will See You Now, is talking about how people are taking control of their health. America's 37th in healthcare in the world, and that's deplorable. We can do better. Physicians only are spending 10 minutes with people and with patients, and people are getting put on 5 or 6 medications really that they don't need. Most patients over 40 or 50 have 4 or 5 doctors and none of them talk to each other. So we see coaching as a tool to be integrated and to help somebody make transitions, whether it's diet, exercise, or making life changes. We see coaching as an integral part of making these transitions.
Okay, so Beth, you're here with us. You're a coach yourself. Tell us a little about what you do, your expertise with coaching, and then just what is coaching in general.
Okay, well, I am a certified health coach. So health coaching is different from life coaching and other types of coaching that are out there.
Okay.
I mean, you even have golfers who have coaches. So what a life coach does, or a health coach does, which is what I do, is we work with clients who have goals for weight loss and or health issues that are mostly associated with the extra weight.
Okay.
And so we work with them on achieving those goals, and health encompasses more than just the diet piece. So we also work with them on the stress that they have in their lives, their exercise or physical activity that they may or may not have. Sleep habits play a very strong role in overall health. So health coaching involves all of that.
Gotcha. All the stuff that people hope to get answers from when they go to the doctor, but the doctor only has 10 minutes.
Exactly.
So
and the doctor's not gone to school for that either. So the doctor doesn't have the time and also doesn't have the tools for
right.
that type of work with it.
4,000 hours of training and
Yeah.
zero nutritional
Well,
training?
you know, I mean, the physicians have about 4,000 hours of training, you're right, and then zero hours of nutrition, and that's so important for somebody's health to understand nutritional deficiencies.
All right, so let's just back up a little bit. Now we got a good intro. So Beth, tell us a little about your history and how you guys started, why you wanted to get into some coaching.
Well, way back when, my very first job out of college, I was in pharmaceutical sales.
Okay.
So I was
Working for the devil.
I was on the road all the time. I covered very, very large areas. So personally, in my 20s, my health was not so great, and I started putting on weight.
Okay.
I had no energy. I was eating out a lot, you know, being on the road or not taking the time to stop and fuel, that sort of thing. So, so I thought I could handle that myself, and I couldn't. So that started my whole interest in nutrition and wellness and what does it take to be a healthy person. So over the years, I did go back for courses on nutrition. I did get different certifications and a degree in holistic nutrition, but everything I could do to learn is what I did over the years. And I did work in corporate America for a large supplement company for a while. So I had a lot of really great education. But health coaching is an emerging profession which has really taken off over the last maybe 5 to 7 years. And so I decided to pursue that because you need to have, I needed it too, a coach for accountability and support, someone to help you learn new habits so that you change your lifestyle to support being a healthy person. So
That's a lot of
it's my
credibility.
passion. Yeah.
Both sides of it. You've seen both sides, so you know how each side works.
Right.
Okay, so different types of coaching now. All these different areas of medical disease could require a coach. So how could a coach benefit medication management, diabetes prevention, tobacco, heart disease, nutritional counseling, diabetes, all that kind of stuff? So talk to us a little bit about that, Russ.
Well, one of the things I think that Beth has, and she has great synergy with what we do because she believes in biochemical individuality. Basically, she understands that every person is different, and her journey, what she just mentioned, gave her a great skill set and tools because she knows one program doesn't fit everybody. So when I see my clients and what they're going through, whether they're trying to quit smoking or increase their exercise tolerance, or they're trying to drop their hemoglobin A1C from eating simple carbs, that coaching skill set that Beth has can integrate into what we're doing.
Because some folks don't have any education whatsoever in any of this stuff, and so they need the first crash course class to understand it. You know,
Well,
there's a lot of stuff that we do with the YouTube channel, and we try and educate them. But then specifically, they might need stuff a little bit more so than others.
And that's great. Another sweeping generalization that we have is that accountability. People, they walk by the refrigerator and they just had a bad phone call and they want to grab the donut because it elevates their serotonin. There's carbohydrate addiction are alive and well. So, that accountability, that person they can talk to, especially if it's a high functioning woman, a corporate woman, everybody comes to her during the day. When she lays her head down on the pillow at night, she has nobody to talk to. It's easy to go for the wine. It's easy to go for a couple of drinks. It's easy to go for, simple carbohydrates just to get her to sleep. The book called Potatoes Not Prozac speaks to how simple carbs can knock you out. Well, alcohol is nothing but a simple carb. So a lot of people under stress, this is how they could roll into alcoholism. It could sneak in the back door. So the accountability portion, bang, can really help folks.
Absolutely. So obviously coaching may not be for everybody, or some folks are interested in doing it but they don't know what's involved. So tell us the first steps of how to get involved with the coach and what you look for in clients.
Right. Well, health coaching is really important and is important to people who have, say, tried to diet on their own. And 85% of people who go on diets regain their weight within 2 years, so the odds are terrible. Actually, people who diet will try 4 times a year. So it's a lot. So what I do with a client then is so important, is to find out, tell me about yourself. What are your goals? What are your health goals? What are your challenges? And I take them through I get a snapshot of their lifestyle in terms of their sleep habits, their physical activity, the stress they may have in their lives, their work schedule, their current eating habits and behaviors. And so I start with that, and then I do find out, why do you want to make these changes? What are your goals? How important are they? On a scale of 1 to 10, how motivated are you? And they need to be an 8, 9, or 10. They need to be ready for change. And if they are, that's really 95% of it.
How about that?
So there's a whole intake process that's involved with it.
Sure.
It even helps you out too. Are you able to work with this individual? Are they coachable?
Right.
Because that's a big thing too. They
Big
have
time.
to be coachable.
They have to be coachable, and they have to be accountable. Yeah, you have to be.
Yeah, being dropped into the second act of a third act play, it's always difficult. That's why this intake is so important. If we're going to help people at the 11th hour, maybe we have to turn some people away. They're not ready because we want to take care of our group and stay healthy ourselves. But a lot of people, it's management by crisis. I see they have some type of incident. Now, this is just my clients. I like Beth's approach a lot more, and it'll be very, very helpful to us. But a lot of people is like, they have that emergency, and they're like, I can't get off the couch, fix me. And I'm like, wow. So this is where pulling a team together to slowly drip on somebody and getting them well is real important.
Yeah. For a lot of people, they like the preventative side of it, but other people, they need that emergency. They go to the doctor, he says, oh, guess what? The big C. And then all of a sudden, boom, eye-opener for them. And so that's maybe their motivation change. So everybody has their different motivation.
That's oftentimes a motivator. If someone goes to their physician and the physician says, you know what, your cholesterol is so elevated now, we're going to need to put you on a statin drug, or you are now you have pre-diabetes. A lot of times that's a real wake-up call for someone. It lets them know, wow, I really do need to make some changes. I'm going down the wrong path. So.
Beth, you've worked with over 300 clients.
Right.
So give us at least one example of a success story that you've had that you've helped them out.
Yeah, there are a lot of success stories, and I love seeing these transformations in people. So one example is a gal I worked with. Her name is Melissa, and I started working with her about 3 years ago.
Okay.
And she is someone that had been very overweight since she was a very little girl.
Okay.
So that's her history. And at the time, she was a smoker in her 30s, on medications for cholesterol and PCOS,
Wow.
and had used the gym as, going to the gym all the time to try to lose weight, and it wasn't working. But we started working together, and she lost nearly 100 pounds in about 8 months, and has continued to keep it off, and she now runs 5Ks.
Nice.
She's very healthy.
How about that?
She's off of all those medications. So that is just one really awesome example of how anybody can actually transform their health if they want to.
Yeah. So some people are willing, they just need that extra step, that extra coach to be
Right.
there, a phone call away, more so
Right.
than scheduling an appointment, going to see the doctor, which is always a
Right.
hassle, as we know.
Right.
So Russ, tell us how how coaching can actually complement the medical system, the current medical system that we have now, because it's tough to go ahead and totally replace it and wipe the slate clean. But how can it benefit it?
Well, yeah, great question. Think about it for a second. A person goes into their doctor's office and says, I need some help. I'm feeling bad. I'm gaining some weight. And the doctor tells them to exercise, quit eating fat, and here's a cholesterol-lowering medication. Doesn't give them the tools. So the doctor's not trained where does the patient turn to now? This is where coaching is going to come in. It's going to fill that gap. It's going to, people, when they make changes in their life, it's really lonely because most of the other people around them, their 5 best friends are all still eating bad. So this person that's going to step away, it's under the heading of social neurobiology, basically says, your friends can affect your health, right? Make sense? So when a person steps away from their group and tries to make changes, it's lonely. This is where the coach comes in, person to make that phone call.
Gotcha. Accountability is big. But also a lot of physicians now have coaches in their practice too, and Beth's going to talk to us a little about that because we have a House resolution passed by Congress. So Beth, tell us a little bit more about that.
Wow.
Yeah, the House of Representatives in December passed a resolution supporting health and wellness coaches and identified all the reasons that we need health coaches in the United States. Given the direction of healthcare, of the state of health of Americans today, there's a real necessity to do something different.
A lot of physicians see the need for that, and so they've brought a health coach or other folks to their practice, correct?
Well, for physicians who want their patients to have another option, if that patient says, doctor, I really do want to lose weight, I want to get healthy, I'd like to reduce my dependence on medications, what can I do? They can refer to a health coach. They could also have a health coach that works in-house in their own office. So that way they're benefiting their patients who really do want to get healthy. So another option for a physician is a physician, especially in private practice, can bring health coaches in-house or programs in-house to help their patients get healthy, and it also helps the practice get financially healthy too, in light of what's going on in healthcare today.
Additional
so
revenue
it's a win-win situation, yeah.
All right, so just to wrap it up here, the current system we have, we all kind of know they're there to manage the symptoms and manage what they have going on, but people are looking to be more proactive. And that's why a lot of this health coaching has become more popular and it's been more integrated. So tell us a little bit more about why it's becoming a big trend.
Okay, let's look at the other trends. So what's going on in terms of the health of Americans today is 70% of Americans are overweight or obese. The diabetes rates are going right up there with it. So, and we talked about this, 50% of the world's pharmaceuticals are used by Americans, but yet we're only 5% of the world's population. So managing the symptoms of non-health is not creating health. So we're seeing a need for a new paradigm, I guess you would say, a paradigm shift really, and that's where health coaching and wellness coaching is coming into play.
That's that crisis point we talked about. America's getting to the crisis point. They're realizing this isn't happening, this isn't working. And it's scary when you go and you think, oh my God, I'm about to get diabetes, and the doctor says, well, you're pre-diabetic. That's freaky. So people I think are recognizing that, and their friends are saying that, and they're like, oh my gosh, what am I doing? Because we hang out all the time. We eat the same foods. So that's why the importance of this is moving in such a big trend, and that's why Russ, you decided to bring Beth along to help with you at the Institute and Scala Precision Health in order to grow this.
Well, really, Beth's skill set after the dialogue and the meetings we had, it's very clear. She's passionate about what she does. She could troubleshoot problems on her own. She could figure things out. She likes to see people get well. I mean, how many people out there are doing that right now? So, of course, with the wide diversity of clients that I have, I know she'll be an added benefit to these folks.
So that wraps up the coaching. Speaking of this crisis point that most Americans see, the good news is a lot of the symptoms and the stuff that we're seeing out there is reversible. It's changeable. You just need to change your lifestyle habits, your health, your wellness, that kind of stuff. And that's where coaching comes in, because when somebody gets that phone call from the doctor, they got cancer, they got diabetes, pre-diabetic, they want to talk to somebody right now. They want answers, they want starting right now, as opposed to 2 weeks or a month down the road when they have an appointment to go to their doctor. They want to start changing now, because that's when stuff starts to fall apart if they don't get that help and assistance that coaching can offer.
Nice.
All right, so that's what we got here, Scala Precision Health. So check us out on our YouTube channel, Scala Precision Health, and get educated. Give us a call. Any questions, comments, we're happy to help.
Great.
Cool. Thanks for having me here.
Okay.
Yeah.
Good
All
deal.
right,
Thank
thanks
you.
for coming in.
All right, Trent.